Why do people get facelifts? It typically is to address the aging in, for the most part, the lower half of the face. That is jowling that comes on with age and loose skin of the neck. And what we do is tighten the skin and raise the substructures underneath the skin so that they're back into a normal position. When a facelift's done, what happens is an incision is made around the ear on each side. The skin is undermined on the cheek and the neck and raised up. Inside, there's a deeper layer called, that we refer to as a SMAS layer. SMAS is an acronym for superficial muscular aponeurotic system. That's why we call it SMAS. But at any rate, we'll raise that up, and that will tighten the tissues deep to the skin and bring the fullness from this part of the face back into the cheek where it belongs. And that gives a youthful shape to the substructures of the neck. Oftentimes, people will have banding in the front of the neck that you can see, and those are muscle bands. If that's the case, we can address those at the time of the facelift and fix those from underneath and then drape the skin over and tighten it. So really what a facelift is going to fix for you is going to be straightening the jawline, tightening the skin around the mouth, and tightening the skin of the neck. You'll see that both face on and particularly in a profile that it will pull the skin of the neck. Now, there's some things that we'll ask you to do ahead of time to prepare yourself for surgery. The first thing is we'd ask you to stop taking aspirin, ibuprofen, Motrin, goody powder, anything that thins your blood for about 2 weeks before the procedure. That way, at the time of the operation, you clot normally so you don't bleed as much and you don't bruise. Second thing, this is the most important thing you can do, and that is nothing to eat or drink after midnight the night before surgery. If you come in the morning of surgery and you have an empty stomach, literally half the risk of the anesthetic is taken right off the table, because if there's nothing in your stomach, then there's no risk of aspiration. So that's very important. The other thing that we'll do is we'll put these squeezer devices called sequentials on your legs before you go to sleep. They're going to pump your legs while you're under the anesthetic, and that'll keep the pressure moving in your venous system, the slow system of your circulation, and that'll make sure that you don't develop blood clots while you're asleep. So when you wake up from surgery, you're going to have a giant headdress on that looks like you had brain surgery. That's completely normal. That's what we do. It's made to hold pressure against your cheeks and your neck. The day after surgery, you'll come back and I'll take that off. You'll have drains behind your ears. Those will come out the day after as well. And we'll put you into an elastic chin strap that you'll put on that'll hold pressure on your neck and your cheeks. You'll wear that night and day for the first week. At the end of a week, I'll see you back. If everything looks good, we'll trim up some sutured tails behind your ears. Most of the stitches actually dissolve on their own, but we'll trim off some sutures as we need to. And then if things are looking good, we'll only wear the neck strap at night for the next week. Why is it important to wear it at night? Because I don't want you shearing on the pillow. At the end of 2 weeks, you'll be able to interface with people that you don't necessarily want them to know that you had something done. The first week after you're not wearing the neck strap, you can go to the grocery store with makeup on and interface with strangers, and you won't have telltale signs necessarily of surgery. Bruising usually fades pretty quickly, so that by 4 weeks after surgery, you'd be comfortable having your picture taken. The time slots that I look at is after a week, you can probably interface with strangers comfortably. At 2 weeks, you could interface with people that you know reasonably comfortably. By a month, you could have your picture taken, and those are kind of the milestones that you'd follow. Oftentimes, while people are having a facelift surgery, they may have other areas of interest that they want to be addressed. And typical things that are done at the same time as a facelift and can be done safely are going to be eyelids, both upper and lower eyelid surgery, and also sometimes injectables, sometimes fat injection to the cheek, sometimes lip injections while people are under an anesthetic. There may be safety in doing other things as well, but that's stuff that should be discussed individually at your in-person appointment. We have all all the safety equipment that you normally have at the hospital, so it's safe to do it here. We use a propofol-based anesthetic, which is an anesthetic that is all intravenous, so you're not inhaling gas. You're not going to be sick to your stomach. It goes into your bloodstream and you fall asleep. We turn it off. You metabolize it so fast that you wake up and you feel really good. You may ask yourself, is it really safe to do this kind of a procedure in an office? And yes, it is. And there's some advantages to doing it here in our office. First of all, it's quiet. It's very private. And the other thing is our staff here is in tune to your recovery. We do about half a dozen different kind of operations here over and over and over again. And so our staff will know exactly how to take care of you during the entire process from pre-op into recovery. So I hope that this video has helped you understand, first of all, what the facelift procedure is going to address. I hope that you understand what some of the risks are and how we're going to minimize those as much as possible. We also talked about your recovery and return to socialization. So that should help prepare you for your visit with me in the office. I look forward to meeting you. We'll assess your individual needs. And also, I've got a picture book full of people I've operated on, and I can show you some before and after pictures.